Health is a right. Critique of Andhra Pradesh's medical college plans. In a powerful statement that resonates with many, former State Secretary of the Department of Health and Family Welfare, P.V. Ramesh, took a stand on April 20, emphasizing that health should be recognized as a fundamental right for all citizens. Speaking at a thought-provoking conference titled Privatization of Medical Colleges and Analysis of Andhra Pradesh Health Budget, co-hosted by Praja Arogia Vedikar, P.V., Jana Vinyana Vedikar, and Mokinini Boiva Panaya Vinyana Kendram, Ramesh passionately argued that it is the government's duty to ensure healthcare access for everyone. He expressed deep concern over the stagnation in the health sector in Andhra Pradesh, despite changes in leadership. Ramesh pointed out that successive governments have neglected their responsibilities, leading to an increased reliance on the private sector for healthcare services. He highlighted Kerala as a shining example of an effective healthcare system in India, where lower mortality rates, better medical facilities, and free healthcare have made a significant difference in the lives of its citizens. Ramesh did not hold back in criticizing the state government's decision to hand over the government hospital in Chittor district to Apollo Hospitals, as well as its controversial plan to operate 10 medical colleges under a public-private partnership (PPP) model. He condemned the practice of charging exorbitant capitation fees and allocating seats based on financial capability rather than merit, calling it fundamentally unfair. He painted a grim picture of the consequences of privatizing healthcare, noting that many families, especially farmers, are pushed to the brink due to skyrocketing medical costs. In fact, he revealed that 1 in every 4 farmers in the state has faced the tragic decision to end their lives because they could not afford necessary healthcare. Ramesh passionately argued that true development should not be measured by infrastructure or GDP figures, but by the health and well-being of the people. Echoing his sentiments, T. Kameshwara Rao, the State General Secretary of P.V., warned that the PPP model would allow college managements to sell off half of the medical seats, leading to exorbitant fees and drastically reducing opportunities for underprivileged students to pursue careers in medicine. This shift, he argued, would prioritize profit over service, making healthcare increasingly inaccessible to those who need it most. M.V. Ramanaya, the state president of P.V., criticized the so-called self-financing model for medical seats under Government Orders 107 and 108, lamenting that the TDP-led coalition government had failed to fulfill its promise to repeal these orders. Adding to the discussion, budget analyst David Sudhakar pointed out a stark reality. While the World Health Organization recommends that at least 6% of GDP be allocated to healthcare, the union government currently spends less than 1.9%. This discrepancy raises serious questions about the commitment to public health. G. Samaram, the former national president of the Indian Medical Association, IMA, expressed his dismay at how commercial interests are overshadowing the service-oriented approach that once defined healthcare. The gathering also included notable figures such as V. Ramprasad, the state president of IMA, advocate Tugor Yodav, prominent cardiologist A. Purnanand, and vascular surgeon Mokinini Kiran, all of whom contributed to the urgent conversation about the future of healthcare in Andhra Pradesh. As the debate continues, one thing is clear: the fight for accessible and equitable healthcare is far from over.